Hi, our group did Great Opportunities, Career Services, and Day programs. Our team members consisted of Angel Thompson, Hannah Blanshaw, Ann McCauley, and Rachel Wright. So the introduction is we did Great Opportunities, Career Services, and Day programs, which consisted of a day program for adults with significant disabilities, including autism spectrum disorder. The day program focuses on recreation and leisure activities, career services, which helped with job training and placement, community employment, or sheltered workshops. The overall goal was to increase opportunities for clients to acquire the knowledge and skills needed to become independent despite a disability through skills instruction. Staff includes client preferences to maintain motivation and manage behaviors. The program consisted of 200 adults with disabilities and including 75 staff members ranging from specialists to BCBAs as well as directors.
Some research on visual scheduling and a background of this intervention is a visual schedule is a graphic representation of scheduled tasks and activities. This includes photographs, drawings, pictures, icons, written words, lists, and real objects. Objects and pictures are arranged either in horizontal or vertical order to display a sequence of events. Enhanced learning and communication for individuals diagnosed with autism spectrum disorder is an outcome of utilizing visual schedules as well as reduce levels of anxiety. A tool for parents and teachers to help adults reach their achievement goals. And this is also used as a reminder for individuals to understand where they should be and what they should be doing and a start to and finish to a task. On my left side, there is an example of object schedules. As you can see, it's just the object and it shows which item is available to the kiddo. On the right side is a picture schedule. It shows one side with to do and the other side is all done. These are examples of color-coded picture visual schedules, and then on the right side, there is a first then schedule. There's also a first, next, and then schedule. This is an example of a real photo schedule. So the difference between this and an icon schedule is real photos are used, and then on the right side, there's a binder picture schedule. The final slide shows a paper picture schedule and a written paper schedule. Both of these show times in which events should occur and the order of which they would occur.
The materials needed for this include a picture-based software, and this can be the Inspired Treehouse, Lesson Picks, or a board maker. Technology can include an iPad or tablet, computer or laptop, as well as a printer, ink, and a portable laminator. You might also need white computer paper, colorful instruction paper, lamination sheets, Velcro dots or strips, some magnets, photographs or online images, binder clips, or scissors, glue bottle or glue stick possibly, a folder, attendance chart, and pens or pencils. And the step-by-step directions for how to implement visual schedules are as follows. Step 1, staff members will review training materials needed for intervention, including visual schedules, preference assessments, and offering choice procedures. Step 2, staff members will be required to attend behavioral skills training, also abbreviated as BST. This knowledge checks will be conducted for fidelity purposes on staff members during the training post. Step 3 includes trainees that will self-model the use of visual schedules, preference assessments, and offering choice procedures. Step 4, staff members will role play with one another to practice a mock intervention using visual scheduling to promote motivation in the autistic adults. Roles could include the team professional and autistic adult. Step 5 will be trainees that provide staff members with additional feedback on their mock intervention. This will clarify any staff questions. And finally, step number 6, staff members will conduct real interventions at the day programs with autistic adult clients. There is also the modeling strategy. So what exactly is video modeling? Video modeling is a teaching strategy in which the learner watches a video of other people engaging in a desired behavior, then copies this behavior with other peers. It allows for the individual to imitate and witness a new skill in action, instead of a staff member explaining it. This would not be appropriate to tell an adult or client what to do if they don't model what they would like to do. It also removes instructive prompting. Adults gain practice with the skill and develop an understanding of constructive criticism. It is also effective in teaching conversation skills. It promotes independence in daily routines of an adult as well. It develops an understanding of daily life skills needed to be an independent adult. So verbal prompting is inappropriate. And the modeling strategy. How to use video modeling. Step 1, use a video of someone outside the clinic. Use an adult of similar age diagnosed with autism. Include a role play. This could be a role of a team professional or autistic adult using a visual schedule. Step 2 would be to create your own video. You always need to ask permission to record. A learning engaging in visual scheduling as an intervention tool for motivation to complete tasks. The videotape of the individual using visual schedules to help motivate them. And finally, step number 3, develop a training session for clients. This allows the clients to watch the video modeling tool for introducing visual schedules. And also, clients will practice in a day program setting of using visual schedules. Finally, staff members will provide feedback to the client's skills behavior. And this is a video that includes how to properly model and implement a visual schedule.
How it will address the problem. It promotes motivation by helping individuals understand expectations and when preferred activities will occur throughout the day. Helps communicate expectations and consequences. Increases adult independence by using self-prompts and cues without additional support. Visualization of how an individual's day is structured, what they need to do to accomplish in order to receive the thing they want. It improves communication skills with individuals diagnosed with autism spectrum disorder and effective in supporting individuals, adults to stay on task in special education and autistic center related settings.
Our school-wide implementation plan. So a snapshot of our implementation plan is, first we address the problem. So we are using a visual schedule tool to motivate autistic adults to participate in life skill classes at a day program before any recreational or leisure activity. We will implement this plan through behavioral skills training and role-playing strategies for staff members and video modeling for adult clients. Our capacity is staff members will conduct preference assessments on adult clients on a weekly basis prior to visual scheduling. This delivers differential reinforcement each week when the staff member knows exactly what leisure activities the client would like to participate in. And autistic adults must complete about 70 to 100% of their visual schedule to earn that reward. Our tier strategy is a tier 3, so it focuses on the individual client while using visual schedules within an intervention session, but our classes and lessons for life skills will be offered in a tier 2 or small group strategy. Our funding streams, at this time, there's no additional funding that will be required. The program is highly staffed with professionals and materials are accessible for the intervention plan. Personal utilization is positive behavior intervention and supports, our PBIS. We'll provide staff members and clients the trainings needed to conduct intervention services at the day program. Our policy will be skill of the month, overseen by PBIS, and will be implemented to teach adults their life skills. Operational procedures are development, implementation, and analysis that will be used through visual scheduling with choice procedures embedded into organizing a visual schedule for the client. Our parent community involvement will be parent to staff meetings conducted by the PBIS team.
Final tips are visual schedule boards will result in effective life skills needed for developing young adult into the real world. It provides organization, structure, and predictability for on-task behaviors, reinforces and supplements verbal instructions, teaches time, concepts, and sequencing, teaches responsibility, and builds self-esteem. And here is our reference page, and this as well. Thank you so much.